My name is Mary Ukpabi-Egbuniwe. I'm a student at Brandman University, DNPU, Psychiatric Program 2020 cohort. My study will be on obesity in African American female ages 30 to 60 years old, and a reduction in weight and maintaining a healthy lifestyle. This presentation is how to educate the stakeholders on the plan and implementation of my research project. A brief description of the role of the stakeholder group, the nurse practitioner. The nurse practitioner will have 9 years experience, performs diagnostic and therapeutic procedures to collaborate with physicians in diagnosing medical problems and prescribing necessary treatment and service for quality patient care. Will be comfortable with technology for documentation, data management and promotion to include use of electronic medical record, data management software, and processing software. The second stakeholder will be the social worker. The social worker's role is to observe clinical behavior, assess and the needs, and create treatment strategies, diagnose psychological behavior and emotional disorders, instruct clients' families during treatment on being a support for the project. The clinical social worker will also do counseling of the obese patients on how to relate their behavior as a contributing factor to the obesity and also in weight reduction. The office manager. The office managers are to assess potential patients for the program participation. That is, assess patients' history and needs to determine if women could be an appropriate fit for the program. Assess in maintaining program data in preparing program reports. Coordinate regular team meetings for women and program improvement. Develop and maintain working relationships with members that can collaborate to improve continuum of care for women. The next is the exercise instructor. The trainer as the exercise instructor will serve in support for the dietitian. The trainer will assess the obese women's bodily strength and weakness and create customized workout plans, provide physical and mental guidance, and monitor the women's progress on a regular basis. The trainer will also make sure that the women do not get injured during the exercise, collaborate with the nurse practitioner on the program progress and appropriate documentation of their progress. The LPN, which is the licensed practice nurse. The licensed practice nurse will work directly under the supervision of the nurse practitioner, performing duties such as taking vital signs, collecting samples labs when needed, ensuring patients' comfort and reporting the status of obese women to the nurse practitioner. The LPN will also be the person that will put the patients in the room or as needed before the nurse practitioner will go see the patients. The dietitian. The dietitian's role and function is to nutrition program to improve and maintain the health of the obese women. This program design will be preventive for chronic diseases such as heart disease and obesity. It will be therapeutic to help the women with obesity with a baseline health and nutrition state. For example, if they have diabetes, hypertension, or other chronic diseases, it will be to help them to maintain a baseline health. I'm going to discuss the theoretical foundation and conceptual framework underlying the proposed CSP intervention. I selected Dorothy Orem Three major theory concepts of Dorothy Elizabeth Oram were selected. It's about a self-care deficit theory of nursing provides theoretical framework for my proposed intervention. It provides three major reflection points to address in this study. First is self-care. What is meant by self-care is the ability of a patient to engage in self-care. The second is self-care deficit, when nursing is needed. Nursing is required when a patient is incapable of or is limited in the ability to provide continuous effective self-care. How the self-care needs are met. How the patient's self-care will be met is through technology and intervention. Several major assumptions was in the theory. I selected one of the major assumptions is that a person's knowledge of potential health problem is necessary for promoting self-care behavior. The goal of this study is to encourage the obese patient to be independent, which is all what Dorothy Owen's theoretical concept is all about. It's for patients to be independent, to learn how to modify their lifestyle by promoting self-care behavior and applying a healthy lifestyle. To teach patients that a healthy lifestyle will be a long life goal. We know that obesity is a condition where a person has accumulated so much body fat that it might have a negative impact on their life. People who are obese are more likely to suffer from high blood pressure, diabetes, elevated cholesterol, and all risk factors for heart disease and stroke. So if this goal of the assumption is applied that a person's knowledge of potential health problem is necessary for promoting self-care, then the patient will be able to be in a position to take care of themselves. What are the educational needs for each group? The nurse practitioner will be proficient in diagnosis and prescribing treatment and also be proficient in using electronic medical record. The LPN will be certified by the state of Virginia, will be trained on how to take the patient in and take vitals and call the women on the phone with their lab results and appointment. The physical trainer will be trained on cultural competence of how to relate to African American women, the unique culture of African American women and will be culture sensitive to their needs. The social worker will be trained on willingness on how to collaborate with multidisciplinary teams. The dietitian will be trained on sensitivity to and compassion for women with obesity. The office manager will be trained as the primary point of contact for the women and the interdisciplinary team. The planning for delivering this intervention. The planning for delivering this intervention. We know that the nurse practitioner, the planning for delivering the intervention. The implementation plan is to guide stakeholders on the necessary action to implement the intervention program for this project. Women will be divided in 2 groups of 10 aerobic activity. Planned by the trainer, it will be three days a week. The intensity will be mild, moderate, and vigorous activity. The nurse practitioner will see the patients before the beginning of each exercise with the trainer, 3 days a week. The LPN will work 3 days a week and will call the patient each week with their labs results and remind them of scheduled visits. On the days that they don't have exercise or visit with the nurse practitioner, the women will be scheduled by the office manager to visit the dietitian and clinical social worker. She will coordinate all scheduled visits. That is 3 days of the week. The patients will see the nurse practitioner and the trainer. 2 days of the week, the patients will see the dietitian and clinical social worker. How will the stakeholders be kept informed of the progress of this project? Meetings will be scheduled every Monday after 5 p.m. to discuss the week schedule and brainstorm on the patient's progress. Each stakeholder will talk about the progress of the women in the program. What is the value of this project? The value or goal of this project is a modest weight loss of 5 to 10 pounds of total body weight. It's likely to produce health benefits such as improvement in blood pressure, improvement in blood cholesterol, and improvement in blood sugar. For example, if one weighs 200 pounds, just a 5% weight loss equals 10 pounds, bringing the weight down to 190 pounds. I hope this plan explains to you about the project and the implementation of the project. Thank you, and you have a good evening. And these are my references.